We're going to talk about sort of a tie-in to John's talk about Listeria and its role in mastitis and its presence in milk. And then a little bit on control. Bronwyn asked me to talk about Listeria mastitis, and I said, well, it's so rare, there's nothing out there. So I designed a whole other presentation on how to control Listeria in cheese, and then the section on Listeria mastitis just kept getting bigger and bigger, so I apologize ahead of time for a slightly disjointed presentation. So anyway, the presence of Listeria on a dairy farm is not uncommon. It occurs very widely with the theory that it's brought in originally through wildlife, birds and rodents, which thereby infect or contaminate your crops, your water, and your bedding, or soil, which then become your bedding and your feed. Host is exposed, becomes a carrier if not infected, and then there's fecal dissemination. And then once there's fecal dissemination, you enter into this whole fecal-oral route of contamination where the animal's constantly ingesting and depositing, and that's the cycle. Not the focus of this talk, but obviously you can imagine that this also leads to indirect contamination of milk. All those sources that might be present during milking can end up in milk if there's unhygienic milking practices. But you already knew that, so we're not gonna focus on that. So most domestic animals are susceptible to infection. These infections can be sporadic, but they can also become epidemics. Some research suggests that the attack rates might be higher in sheep than in other species such as cows and goats. When it presents clinically, it most often presents as encephalitis. So if anyone's familiar with circling disease, where sheep will just go in circles and circles and circles, that's an indication of neurological symptoms from encephalitis. It also occurs as septicemia and, where applicable, abortions, typically in the third trimester. Very often, though, these infections are going to be subclinical. Okay, so these are going to be animals that are infected but are not going to outwardly show any signs. One of the ways that you can detect or identify current or previous infections is through serum antibody testing for virulence proteins that are only found in Listeria monocytogenes, which are Listeria lysine O and ACT-A proteins. So infections typically happen between November and May, with the highest incidence between February and March. And you can imagine this closely links up to or correlates with the movement of animals from pasture to indoor housing and a switch from feeding on pasture to silage feeding. And so the stress of overcrowding and the switch to silage are probably the highest, have the highest contributing factor, with poor quality silage being the absolute number one. Now, I wish I could give you the specifics of exactly what poor quality silage is. We typically say pH over 5, but that's not your magic number. You can certainly have Listeria contaminated silage at lower pHs, but if you try to sort it out, the occurrence is significantly higher as you get above 5. Also high moisture feeds or feeds with obvious mold contamination. In terms of prevention, there are vaccinations out there, but their implementation's been quite limited due to the cost-benefit analysis. It just doesn't really add up. So the problem that we're mostly faced with is what we call asymptomatic GI carriage and fecal shedding. So these are animals, and actually humans are the same. We're exposed to the pathogen, our immune system fights it off, we don't show clinical signs, but we become carriers. And so animals can become can be carriers and shed for months to years. If you do analysis of feces, you can actually track, it correlates pretty well to levels in feed, and it also correlates to that cycle of fecal-oral contamination on a farm. Unfortunately, asymptomatic shedding directly into milk, hematogenous, so blood-borne direct contamination of milk occurs, and this can happen over several lactations. The levels that you'll find in milk vary, and they vary very frequently. So you can see anywhere between 10 to greater than 20,000 cells per milliliter of milk just by following a single animal through an infection. Now, environmental contamination, like we talked about, environmental contamination of milk can also lead to mastitis, and so can these generalized infections. So generalized infection would lead to contamination of the milk through the blood, and then there's a chance that those organisms passing through will then take up residence and colonize the gland. So mastitis is considered rare, but I think more likely we just underestimate the disease burden. If it's subclinical, it often goes undetected. Again, with mastitis, there's no symptoms. The milk isn't really affected. So you're not going to see major changes in milk quality, and you're not going to see major changes in milk appearance. There's some reports that there can be a reduction in milk yield in the infected quarter. So some reports of 20 to 60% reduction in milk yield, but that's not always the occurrence, so that's hard to follow as well. So the best way to sort of track this is an infected quarter will have, or a gland will have somatic cell counts above 1 million, compared to an uninfected gland, which could be 100,000 or so. And so the infected glands will shed, again, much like the generalized infection, we can shed between 10 to more than 100,000 cells per milliliter. And this becomes a real problem depending on the size of your herd. So you can be screening milk every other week and not find any Listeria, and then the week that you don't sample could be the week that it's at 100,000, and if it doesn't get diluted out well, you can have a pretty heavy load in your raw milk, raw ingredients. So same thing, prolonged excretion periods, just like a generalized infection, a mastitis infection can go on beyond a year. Unfortunately, it doesn't respond very well to antibiotic treatment, so we're typically looking at a culling. In terms of detection and reduction, so force stripping has been shown to be to reduce risk. One, because you're looking for abnormal milk, but in a Listeria infection, you don't necessarily going to have abnormal milk, so the argument might be that you're actually stripping out the phagocytized somatic cells that were holding the pathogen. Individual screening through California mastitis test has been shown to be quite effective, followed by somatic cell cultures, somatic cell counts in cultures of individual animals. From a herd level approach, the best way to approach or detect Listeria in your herd is through milk filter screening. It's funny, this sort of started in the research world, but it was never really practiced outside. But screening milk filters is great. It's inexpensive, very convenient. You can get a composite of the entire farm environment. So if you've ever looked at your milk filters, you know they have the milk clots, fibrin, fecal material, feed, dirt. All the sources of infection or sources of the pathogen will be collected in the milk filter, which also aids in adherence. And then throughout the milking period, they can actually multiply and gives you a better chance of collecting them. And so what we found is there's about a 3 to 10-fold higher isolation rate from milk filters compared to bulk tanks, which has always been fun in my experience because I test milk filters and I say, hey, you have Listeria in your milk, and they say, well, we just tested that milk and there's nothing there. And I said, well, it is there, you just can't find it, and you get into this battle of, what do you do? If you can't find it through one method, do you trust the other? It's just that much more accurate because you're not just testing the milk, you're testing the milk, all the environmental things that the milk has been exposed to. So in terms of incidence, this is kind of difficult because most of our research is based on this figure right here. 2 to 4% of all milks, all bulk tank milks, from US, Canada, and Western Europe, 2 to 4% could be contaminated. I always have this problem because that's all milks. That's not the milk we're talking about, right? So a lot of my research is focused on, well, what's the incidence in raw milk that's intended to be used for raw milk cheese production, not all the raw milk in the world. And so through my research, it's on the lower end, at least in Vermont, but it's not wholly inaccurate. Again, there's lots of variables, and I can't get into them all, but the other issue is that in terms of detection, the levels that we're going to find are typically very low. So in my experience, I've never found anything above 1 cell per milliliter, and the literature typically reports under 10. So again, finding it in milk through routine milk testing is quite difficult. That's where the milk filters come in handy. Now, even though the levels are very low in milk, if you didn't know, Listeria can grow quite well in the cold. So we recommend very frequent or early use of milk, so 24 to 36 hours or so, because longer storage will promote a shift in the microbial population from those that can and can't grow in the cold, and Listeria is one that can grow. So just to give you some case studies, there's actual incidences where we've seen this sort of rear its ugly head. 2001, there was an outbreak with 120 illnesses from a fresh goat cheese. And through the investigation, they traced it back to a single goat with mastitis, shedding up to 18,000 or so cells per milliliter of milk. They also found cross-contamination from animals grazing together. They had cows out with the goats. And they also found the same exact genotype throughout the environment. So not only are they bringing in contaminated milk and making a product that was contaminated, but just the act of bringing in that milk and having it in the environment contaminated the processing environment, including their brine. There's also a couple of case studies in the references are provided. You can kind of read up on them, but finished product contamination, companies, or the government finding contaminated finished product and saying, hey, where did this come from? 2 cases were actually traced back to a single ewe. Again, somatic cell counts are typically above 1 million. In this case, they also had positive California mastitis tests. And the milk varied between 10 to the 1 to 10 to the 5. So again, the levels in milk will fluctuate over time. And in both these cases, the same exact strains were found throughout the processing environment. So what starts as a problem outside on the farm ends up becoming a processing room issue as well. So like I've sort of already mentioned, we found there's significant correlations between the amount of fecal shedding with silage feeding and Listeria monocytogenes in your environment. So as farm-fed cheesemakers, we have to sort of consider Listeria being this holistic sort of approach, attacking it at all angles. And we have to remember that most cases of Listeria, listeriosis cases from food actually come from post-processing contamination from the environment. So not the focus of this conversation, but really strong environmental control is really paramount. And that's because Listeria is a hardy little bacterium. The pH, so this is pH growth, or conditions for growth. It can grow down at 4.4, water activity is down to 0.92. It can grow up to 10% salt solutions, and it can grow down to below freezing. So really, really hardy. And here's just an example. There was a study done. They found Listeria survived 260 days in a refrigerated commercial brine at about 24% salt and pH just under 5. So it's really, really difficult to control once it gets into your system as well. And again, I'm not going to get into all the factors here, but when Bronwyn said, hey, can you talk about control of it in cheese? And I said, absolutely. Do you have like a week? There's so many factors that play a role, and I just listed them. There's a couple interesting ones. The specific strain, I don't know if any of you've heard, but individual strains of Listeria monocytogenes have different abilities to infect animals versus humans, to colonize processing environments versus grow in cheese. So just at that, if you can imagine, that's like some of if we drill down, that's how low it gets. But then you understand how complex cheese is, and you can understand how complex it is to give you an overview of how to control it. But I'm going to give you a quick background on a couple of things and see where we're kind of going. So from a cheese perspective, we have our extremely low-risk cheeses. So anything that undergoes a fairly high cook, generally over about 50 Celsius, is usually not a problem. I don't know if you can see, Listeria is the triangle. And so right after curd cooking, we have death of the organism from levels of just under 100,000 per mil of milk. So you'll see the same observation in Parmigiano Reggiano or any cooked curd cheese. That high temperature exposure is typically lethal. And if it's not lethal, we end up with a sort of a low moisture cheese. If it's a high cooked cheese, we typically end up with a low moisture cheese, and then we also have long aging. So we typically regard these cheeses as sort of Listeria proof. Sorry, I gotta manage my things here. And then there's also interesting takeaways. So this is blue cheese. If we start with between 10,000 and 100,000 per gram of cheese, you can see that the population drops significantly over the first 20 through 60 days or so, okay? It doesn't completely disappear, but it drops, and most people would assume, well, as the pH comes up in a blue cheese, we would expect the growth to come up. But we don't see that in blue cheese because the breakdown products of lipolysis produce antimicrobial fatty acids. So again, just giving you an idea of the complexity here, you would assume one thing, but then you have to take into consideration that nature has its own antimicrobials like caprylic acid, which is a very strong one, and lauric acid, which are produced during ripening. So you have this inherent control despite favorable conditions. If you take away those antimicrobial fatty acids, such as in a feta cheese, you actually can see growth of the pathogen during the early stages of manufacture and ripening, and then given its salt and pH tolerance, you see essentially this long, prolonged survival in the cheese. All right? And that happens in a bunch of different varieties. And then if you take away that pH effect and you have something like a surface mold ripened cheese, I'll try to guide you here, but if you start with about 1,000 cells per gram, the first 2 weeks, when the pH is low, you actually see the death of Listeria. But then as our surface flora starts to take over and the pH starts to grow, that whole death turns around and actually becomes exponential growth. And so this is very similar to feta in terms of composition and pH. But as soon as we have that surface flora growth, the tides turn and Listeria grows quite readily. And so I always laughed because our US law is to age raw milk cheese, and I said, well, hey guys, guess what? You're making cheeses more dangerous by making us do that. So in response to this concern, FDA joined up with Health Canada to do a risk assessment of listeriosis associated with the consumption of soft ripened cheeses, and they concluded that the use of raw milk provided a 50 to 160-fold increase in risk. But then if you look a little more closely, you see that this is based almost completely on assumptions. And one of those assumptions is high raw milk contamination levels and contamination rates. And that is directly attributed to the fact that we can find asymptomatic shedding in milk. And so they took that data and said, hey, there can be high levels of Listeria in milk, even though most reports find it at very low levels. We have to take that into consideration. So the reason I come back to that is if we can, through management and testing, control the incidence of high levels of Listeria in raw milk, then it kind of throws this whole concern out. They also, this is compared to using pasteurized milk, they didn't really have any data on environmental contamination. So a pasteurized milk cheese is a whole lot safer when you take out post-processing contamination with Listeria. So some of the alternatives they explored, just to give you an idea, is they said, okay, well, what if we treat raw milk with an intervention that'll get rid of 1,000 cell, or 1,000-fold, a 3-log reduction? What if we remove 60-day aging? What if we tested 25 mils of every lot of raw milk? And what if we tested 25 grams of every lot of cheese and removed those positive lots? And what they found was the 3-log treatment wasn't very effective. And that's because in their models, they had to use very high levels of contamination. So again, if we can remove those high levels of contamination, a 3-log treatment would be plenty. If there's only one there, a 3-log treatment is extremely effective. If there's 1,000 there, then not so much. If you remove the 60 aging period, there's a minor reduction in risk. Again, if you mentally go back, don't go back. If you mentally go back to that slide, the growth of Listeria just keeps going as time goes on. It finally reaches a peak, but if you sell the product earlier, there's less Listeria in there. Testing raw milk was beneficial, but not that good. And again, testing raw milk is like dipping your arm into the lake and trying to pull out a fish. If you test raw milk, it's like trying to pull a fish out of a net. Or filters, I mean. So that's why we push for the raw milk filter testing. They didn't choose to use that approach. So the most effective approach was actually testing 25 grams of every single lot of cheese and removing positive lots. And if you do that, it becomes safer than pasteurized milk cheese. That was their conclusion. The problem is that they only looked at these alternatives. They didn't consider what I call comprehensive approaches, which include everything outside of these direct approaches. Like, what about, I don't know, taking care of your farm and testing your environment and doing all these things? It's not, they didn't look at that. They also didn't look at any more controls than these four, and they didn't think about combinations of controls. You know, what if you implement this practice and this practice and this practice, which is what we do in life. So that's not there. So just to close, because I'm trying to keep us on time for questions, where my research is focused is sort of these novel interventions, and this isn't my research because it's not ready yet, but what we're looking at is, okay, what other approaches can we do? Can we still come at it with our normal approach, but then have some sort of natural treatments that we can do? And so there's a lot of research coming out. This is a study that came out in 2014 looking at, well, what if you had contaminated Queso Fresco? Is everyone familiar with Queso Fresco? So Queso Fresco is what I call it Petri dish cheese. It grows Listeria better than I can in a Petri dish sometimes. So here it is, if you have 10,000 cells per gram, very quickly it reaches up in the tens of millions. So it grows very, very well on this cheese. These researchers use caprylic acid. So if you recall back to the blue cheese, caprylic acid is a very antimicrobial fatty acid. They combined it with niacin, which is a sort of a natural antibiotic produced by bacteria, and you get an automatic 2-log drop in the count of Listeria, and you get a sort of a prolonged control. I mean, it'll still grow. So that's if the curd was contaminated. My research is focusing on various forms of caprylic acid and lauric acid and things like that. And within 2 years, I'll have plenty of data to show. I'm securing my position for. So then this is what if Queso Fresco gets contaminated on the surface? And I'll try to guide you through this, but basically here's our control. Again, it just grows very well. These authors used something called lauric arginate, which is a lauric acid mixed with arginine and alcohol. And I can't remember exactly which one is. It's the circle. So you get about a 2-log drop, but then the cells recover and grow fine. If you use Listeria phage, is everyone familiar with Listeria phage? This is becoming a commercialized, pretty common intervention. You get about a 2 to 3 log drop, but again, it grows back. And then if you combine those two treatments, you get even more of an activation, but again, it grows back. So these are great interventions, but unfortunately, they don't prevent regrowth. And if you're working with a high-risk cheese like a soft surface ripened or a soft cheese like Queso Fresco, that regrowth is significant. So what we need to do is combine them with what we call Listeria static agents. So in this case, this is lauric arginate. We get our 2-log drop combined with potassium lactate or sodium diacetate, and you get prolonged control throughout the shelf life. So if you don't use the Listeria static, you actually get significant regrowth. So we want to be able to kill the cells off, but then we also want to keep them from regrowing. And so when I present my research in the US, they go, well, there's still a log of Listeria there. And I say, well, okay, but look, it's not growing and it's not going to make anyone sick, right? So in this instance, we would have a safe product. This is with the Listeria phage. Again, we get almost complete inactivation. It's not perfect. If you don't use a Listeria static agent, it grows back. If you use a Listeria static, it stays low. Okay, so if you're in a country that allows a certain limit, like 100 cells per gram, these approaches are very, very effective. And so that is the end of my talk. But the future of my research is to look at control using the natural antimicrobials, and I can give you a very large list to add to raw milk to control pathogenic organisms and preserve the microbial diversity, which is what we're working on. And then we're looking at surface control. We're looking at how can we kill Listeria and still allow surface flora to grow. And so there's a lot of work ahead, but I think there's a lot of potential here, and I hope I can share it with you all in the future.